This presentation is on medication management for your home visits. After this presentation, you will be able to understand medication administration, understand medication reconciliation process, recognize duplication of medications, interpret physician medication orders, and educate patient and family on medications. These are the 8 rights of medication administration. First, make sure you have the right patient. Check the name on the order and match it to the patient. Make sure you ask the patient to identify him or herself and match that with the medication bottle. The right medication. Check the medication order and the label on the bottle and make sure that those two match. Right dose. Check the medication sheet and the doctor's order before medicating the patient. Beware of differences of adult and pediatric doses. Right route. Check if the route ordered is appropriate and confirm that the patient can take or receive the medication by the ordered route. For instance, if the medication is oral but the patient has a PEG tube or G tube, then possibly that patient is not able to swallow, so you have to make accommodations like crushing the medication and administering it through the tube. Also, when you're administering subcutaneous medications, be sure to rotate the site. Right time and frequency. Check the order and when the patient last took the medication. For instance, if you enter the home and the blood pressure is still elevated, but the patient says, "I just took my medication 1 hour ago," do not administer the medication again. Wait for the medication to take its full effect. Right documentation. The only time we document medication administration is after you have given the ordered medication. At that time, you must chart the time, the route, and any other specific information that is necessary and pertinent to this medication administration. Right reason. Know why the medication is being ordered. Know the patient's health history and why he or she is taking this medication. If you don't know, ask the patient. If the patient doesn't know, please do not administer any medication that you do not know why the patient is receiving it. Be sure to have your phone available with internet access so that you may look up the different reasons a patient may be receiving a medication. Right response. Check if the ordered medication is doing what it's supposed to do. For instance, is the Lasix or the furosemide causing less edema, and is it lowering the blood pressure? If it is, that's the desired response. If it's not, we may need to revisit the medication and speak with the doctor about changing the dose or switching to a different medication. When you're doing a medication reconciliation with your patient, there are a few things that you need to consider to determine whether or not this patient will be compliant with their medication regimen. You need to assess for adequate social and community support. For instance, does the patient remember to take their medications on their own, or is there anyone else to remind them to take their medications? Who sets up their pill boxes when you're not around? Educate the patient and patient's family on proper dosage, frequency, and side effects. Make sure you explain the side effects of certain medications so that the patient does not abruptly stop taking medications because of the side effects. Just as you want to make sure that they know the side effects, you want to make sure that they are aware of the adverse effects and they let you know what adverse effects that they may be experiencing so they know when to stop the medication and notify the physician. Evaluate therapeutic responses to medication. Assess the effectiveness of pain management. Ask the patient if they're taking their pain medicines and if the pain medicines are working. Tell the patient that it's best that they take their pain medicines before they experience great amounts of pain. They want to catch that pain early, or else it will be hard for that pain medicine to be effective. Assess for duplicate medications. You also want to assess for expiring medications and be sure that the patient is educated to throw those medications away. Assist in developing medication schedule. Ask the patient if they would like a pill box. My Family Care's Home Health is trying to do everything possible to maintain health and promote health. So, if the patient needs a pill box, we can make those available. Review medication regime. Complete a list of all prescribed medications and medications found in the home. Assess for drug interactions and adherence. The medication reconciliation process should be done with each assessment on each visit. Every time you enter the home, you should always be doing a medication reconciliation. What exactly is medication reconciliation? Medication reconciliation is when you match each medication on the patient's medication list to the medications that they are actually taking. All oral medications, insulin medications, medicated creams, and medications that are over the counter should be included in your medication reconciliation. It should be updated in the medical record. The nurse is the last line of defense before any medication error. So always make sure that the medications that the patient is taking matches the medication list. Educating your patient is the most important aspect of your home visit. We want to plan interdisciplinary education on medication management on various medication classifications. What I mean by this is, you want to educate your patient and let them know maybe they're taking 2 blood pressure medicines, but they need to know why they're taking 2 different ones and the importance of each one. We have quick access guides to medication information if you're unsure of a question that the patient may ask you regarding a medication, and these are some examples that we have. If you need additional patient education material, please email me and I will provide you with that information. I want to make sure that whatever we teach our patients here at My Family Care Home Health is uniform and all patients are getting the same high quality information. Ensure some teach back is going on to evaluate if whether or not you taught the patient and they're receiving that information in the appropriate manner. We want to make sure that not only are you speaking to them, but they're receiving and interpreting the information as they're supposed to in a way they can understand and have some medication competency. Some things to remember about medication administration. Be sure to check the blood pressure before administering any antihypertensive medications. If the systolic blood pressure is less than 100, you may want to hold some of the blood pressure medications, only if that is indicated by the physician. If the heart rate is less than 55 beats per minute, you may want to consider holding the beta blockers. Check the blood glucose reading before administering short-acting insulin. Check for any signs of outward bleeding before administering any anticoagulants. If the patient refuses medication, find out why and make sure you document this in your charting. If you don't know why you are administering a medication, please do not administer until you find out why, because that is a medication error. If you don't know why you're administering a medication, you should not be administering that medication.